Good morning, subscribers, patients, and especially to Dr. George. So, Dr. George, I promised you that I will make a video to explain how do we treat some basic dry eyes in the practice. Now, dry eyes, we've actually made a video to explain that in more detail, but this is what we do in the practice. So, of course, dry eyes, it's a subject that we can talk about the whole day. But I always tell my patients that when you are looking at dry eyes, and this is the weirdest word actually for dry eyes, because very often what you experience as a patient is red, irritable, runny eyes. You don't actually experience a dry eye. We call it dry eyes in our profession simply because there's a lack of lubricants and nutrition. So when we're looking at to fix a dry eye problem, we have to look at the whole body and the environment. So anything that's going to affect the secretions from your lids, or that's going to affect the environment in which you are actually living and working, that might eventually affect and give you some dry eyes. So in general, we always tell our patients, drink enough water. Make sure you do some exercise because you want to stimulate the blood flow. If you want to, you can try actually standing in a shower, raising your head like that and having some warm water splash on your lids. That's also going to stimulate the tear flow and stimulate the blood vessels that's supplying the lids and that's making these oils. So every time you blink, there's special oils that is secreted by your lids. Now, what do we do in the practice to solve a basic, very simple dry eye problem, which might be due to you getting older, it might be due to the wind blowing, you working in some air-conditioned office. Firstly, what we tell our patients is you start off with your Ocuvite. Now, especially if you grow older, the Ocuvite not only helps for the dry eyes, it also feeds the back of the eye as well, the retina. So it also helps with this macular degeneration, which we are all prone to these days as you grow older. Of course, the Ocuvite goes together with a Amsler grid. And if you look at this Amsler grid, you'll see there's a fridge magnet at the back. Now, the Amsler grid is basically to look and to make sure that if you do have macular degeneration, you will actually pick that up, any changes. So normally what we do is we tell our patients, you start off with 2 tablets after your main meal. And remember, when you look at vitamins, you get 2 categories of vitamins. The one says water soluble, that's your basic vitamin Bs and your vitamin C. And as the name indicates, its solution is in water. It dissolves in water. So water-soluble vitamins, and then you get the fat-soluble vitamins. So fat-soluble vitamins are, for example, your vitamin A, D, E, and your omegas as well is also fat-soluble. So these things you want to actually take 2 tablets after your main meal, directly after your main meal with a bit of water. And if you don't have any fats in your main meal, include maybe a spoon of olive oil. So we start off with basically looking at just getting some more oils into your body because your lids are secreting oils all the time. So first step is your Ocuvite. Then the second step, we very often suggest try some Artelac Intense. Now, these drops has got a special formulation. There's also a vitamin in this as well, a vitamin B in this thing. And the way you want to take these drops is 3 or 4 drops, especially if you're working in front of a computer, air-conditioned office, or you may be an outside tradesman. It's hot, it's windy, or air-conditioned in the vehicle. You want to keep this with you. So the reason why we actually prefer this is this specific drop can be used with our contact lens patients and our dry eye patients as well. And as long as you raise your chin, you pull down your lid and you put the drop in so that it falls through air, the air actually oxidizes some of the preservative. So there's really a very small amount, if any, preservative entering the eye. But having some preservative means that this drop, you can actually carry it with you. It doesn't rot so easily. It lasts longer. We find that the non-preservative eye drops, they have their own problems. They don't like heat too much. They must be maintained in a fridge environment. They single use. So the single use eye drops, non-preservative, they have their place, but for practical reasons, we actually prefer using Artelac Intense. And this is how it looks. This is the daytime drop. And at night, you're welcome to leave this, for example, in your fridge. Now, if you need something a little bit more oily, thicker oil, you want to use a thicker oil, this is the Artelac Advance. Now, this drops, we tell our patients that if you have severe dry eye, you can use them, but they do leave your vision slightly fuzzier for longer, where the intense eye drops don't actually do that. So this is a very nice drop for daytime use, 3 or 4 drops a day, used with the Ocuvite. Very often you'll find that it makes your life just so much easier and clearer and just more comfortable. Often we would tell our patients that you can use this maybe before you go to bed, a half an hour or so, or maybe within a couple of minutes when you wake up, when you don't need to see crystal clear. So this is going to leave your vision slightly more fuzzier. But if you do want something even at night, maybe you're sleeping with a fan or air conditioner, you want to use maybe something like the gel. So this is one of their other products, and we find that the combination of these products actually helps most of our patients with some basic dry eye that has a basic dry eye problem. Of course, if you are prone to a bit more itchiness, we have a product there, or they have a product here, that also helps for a little bit of itchiness. The Allergy Artelac drops as well. It's like a little pump as well, and they work very well also. But most often, for general dry eye conditions, make sure you increase your oils, make sure that you have your Ocuvite, and keep your Artelac Intense with you. And when you put the drop in, make sure, this is very important, make sure you tilt your head back and you actually just drop it in so that the drop goes through air. Now, if you have a severe dry eye condition, something like Sjogren's syndrome or borderline, then this will also work, but you might need something a little bit more stronger, something that has got a prescription. Now, in South Africa, we can't actually prescribe these medications, but there's an antibiotic you can use, because very often you might land up with an eye infection or eyelid infection. There's also some other drops that you will be using to ensure that the surface of the eye actually now is more protected if you have that. Thank you very much for watching, and if you have any questions regarding dry eyes, you are welcome to contact us.